Hi everybody, this is Olivia with Seeds of Healing, and I have one of Johnson Ranch Racket Club's tennis pros on my table today, and he's experiencing some sciatica going down his left leg. So today I'm going to show you treatment to reduce that pain and also the homework that you send home with the client to keep that treatment going. So first we want to loosen up L3, 4, and 5 within the low back. And as you can see, we've got the whole body really kind of moving to really open up all those muscle attachments. And then we really want to open up that QL, and we really let the body just rock into it and let our hands work deep into that QL on the side there and opening up that communication. We definitely want to check where the PSIS is on each side and see if it's in alignment or not. Now, Gary's a little bit out of alignment on the right-hand side. It's hiked up higher than the left. So we just do across here, we've got one hand on that PSIS, the other on the rib, and we're just lengthening that space on that side and even push those ribs up and that PSIS down. And the same for the spine. Pushing down on the sacrum and up on the spine, creating space. Next thing I'm going to do is see if we have an interior tilt on the side of the body. And so we've got this whole side of his body is a little bit down toward the table, and this one's a little higher. And with this, we're going to be, normally I wouldn't do it from this side, just relax. Normally I'd be doing it from the other side, but for video purposes. So I'm going to pull up on the side that's leaning forward and push down on the opposite. Give it a little bit of tweak here. And as I hold it up, I ask Gary to give me some resistance, pushing down for 5, 4, 3, 2, 1, and relax. And now Gary's nice and even and no twist left in that body. Next, what we really want to do is just open up the glutes a little bit and open up that line of communication there, how that peroneal nerve and that sciatical nerve will run through piriformis. Now for today's purposes, because we're doing a video, I don't often use this technique to open up the glutes anymore. Most of the time I do cupping and pull the tissue off the nerve, but this is still very effective. You doing okay?
Yeah, it feels good.
All right, go ahead and relax here. So now we're gonna get a little bit personal, which is why we definitely wanna have some shorts on with any of the clients that you're working on. As you come down to that gluteal fold, we get to the ischial tuberosity, and just inside that ischial tuberosity is the nerve that runs through here. Now, Gary, what I would like you to do is pelvic tilts toward the table and then toward the ceiling. So you're gonna roll your hips in and out. Good. And you just let your thumbs roll over that tissue where that nerve is. All right, how you doing?
Good.
Okay, good. All right, thank you. All right, Gary, I want you to go ahead and scoot down the table and roll face up. Okay, so now we're on the left side here. And let me have you scoot, oh no, the other way. Okay, so now we want to get a nice stretch in that lumbar spine. So Gary, what I'd like you to do is bend your knees, bring them up to your chest for me, and you're going to hold on to them with your arms. Now, leverage is super important here for body mechanics. You want to be able to push their body up, come underneath that sacrum, and then we're going to just lift up. Give me a little stretch on that low back Keeping an eye on your client, making sure it's not increasing pain. Is that increasing pain?
No, good.
Good. All right. So we're getting a good stretch there?
Yep.
Okay, good stretch. And now because Gary's having the symptoms on the left side, as you come up, you want to swing him over to the opposite side and really open up where that nerves are between L4 and L5. Good. Okay, Gary, go ahead. Now what I want you to do is roll onto your right side. I may have to adjust the camera angle for this. All right, so the next thing that we're going to be doing here is nerve flossing. So that nerve begins up in the brain and it runs all the way down that spine and out, down the leg and to the foot. So we really want to start opening up that whole line of communication. I really think I do need a better angle here, so my apologies. And good. Okay, Gary, so what we're going to do here is you're going to let me have this leg. And I start off nice and easy, not full flexion in the hip, but most importantly, we want to keep this ankle flexed. And are we getting symptoms right now?
No, good.
Okay, so I'm going to come forward until you tell me to stop. Until you really feel that stretch. How's that feeling? Right there?
Mm-hmm.
Okay. So at this point, what we're going to do, Gary, is I'm going to be going back and forth. And when I come towards you, I want you to bring your chin towards your chest.
Okay.
So here we're doing a little dance, and I am totally blocking the video. And let's see, I'll do it from this side. Here we go. All right, so here we go. Now you can see what I'm doing. Got the ankle flexed, nice locked knee, and we're flexing the hip, and we're bringing that in together. And then the client's gonna bring his head towards his chest. And then as I come back, Gary, I want you to just neutral, perfect like that. And we come together and back. Together and back. And so, Gary, what I want you to do is let me know when it lightens up. Now try not to help me move the leg, okay? And back. So let me know when it feels like that stretch just kind of opens up.
Good.
Feels good. So can we take that a little bit further?
Mm-hmm.
All right. So now that that one opened up, we take it a little bit further till he feels the next stretch. Right here.
Right about there.
All right. So I'm going to come back off a little bit. And now we're going to start the flossing where he brings his head down, his leg up. And let me know when this one starts to clear up.
Feels good.
Feels good. All right, so now when I come in, I want you to bring your head and your chest forward. Okay? So head and chest forward and leg in together. Back, he goes back. Come in together, and he goes back. And let me know when that lightens up.
That's good.
That's good, and he's starting to feel good.
I didn't know it was that limber.
Nobody knows they're that limber. Okay, go ahead and sit up again on the side, and we're going to do a little reassessment on how your sciatic nerve is feeling. Okay, so go ahead and straighten your leg for me, and I'm going to flex this ankle. We're going to hold that there, and if you can, take the pressure off your arms and just sit in this.
Okay. We
really want all that pressure on there. All right, are we getting any flare-ups?
No. No.
What's your pain scale right now?
4, 3, 4.
3, 4. So we went down from a 5 to a 3, 4.
Yeah.
Okay, great.
Feels better.
Good. Now what we really want to do is get that down to a 0. But part of getting that down to a 0 is Gary doing his homework. All right, Gary. So basically that same move that we were doing on the table. You want to take that left leg, really lock that knee, flex that foot. And you're going to do the same thing. Bring your head together and your leg together. And keep that stretch going and moving. And what we're doing is we're getting that nerve to move inside its sheath, getting that communication open from the brain all the way down to the foot. And when you got that opened up, you bring it further and bring the chest down. So this is going to be extremely important for your recovery to do this at least twice a day.
Okay.
When you wake up in the morning, wake up in the evening, until it feels good.
Okay.
Really, until it feels good. Usually only takes a couple minutes.
Okay.
Okay, great. Thank you so much for your time, Gary.
You are welcome. Thank you.
Bye, everybody.